Welcome to the deep dive. Today, we're really getting into a topic that affects quite a few dogs and their owners, diabetes mellitus.
That's right. We're working from some detailed veterinary medical text here.
Yeah, and our mission is to break it all down for you, give you a solid, understandable overview of canine diabetes.
Exactly. We want you to get the essentials, the causes, the signs, how it's diagnosed, how it's managed. We've dug through the medical source material to pull out what really matters.
And it might seem straightforward, but our source pointed out some surprising details, some important differences within the condition itself. It's definitely more than just, like, high blood sugar.
Absolutely.
Okay, so let's jump right in. What is canine diabetes, fundamentally?
Well, at its core, it means the dog has persistently high blood sugar levels, even when they haven't eaten recently. That's
Wow.
the hyperglycemia part.
Right.
And when those levels get high enough, the sugar actually spills over into the urine. So fundamentally, it's a metabolic disorder.
Meaning it affects how the body handles nutrients.
Exactly. Carbohydrates, fats, proteins, the body struggles to process them correctly. And it all comes down to a problem with insulin. Either there's not enough of it, an absolute lack, or maybe the body isn't responding to it properly.
Okay, absolute versus relative lack or not responding properly. That sounds like a key distinction. Can you unpack that a bit for dogs specifically?
Sure. So the most common form we see in dogs is called insulin-dependent diabetes mellitus, or IDDM.
IDM, got it.
This usually happens because the dog's own immune system, for some reason, attacks and destroys the cells in the pancreas that make insulin, the beta cells.
Oh, wow. So the body attacks itself.
Pretty much. And when those cells are gone, the dog absolutely needs insulin injections to survive. That's the dependent part.
Okay, and the other type, less common, you said.
Yeah, less frequently, you see a situation where there's a combination of not quite enough insulin being made. That's the relative deficiency. And the body's cells aren't responding to the insulin that is there as well as they should. We call that insulin resistance.
Ah, okay, a double whammy, sort of.
Kind of. And what's interesting is this second scenario can sometimes actually progress and become full-blown IDDM anyway. Or sometimes it might lead to what's called non-insulin dependent diabetes, NIDDM. But honestly, NIDDM is pretty rare in dogs compared to IDDM.
So bottom line, IDDM, where they need insulin shots, is the main one we see in dogs.
That's the vast majority, yes.
Okay, so when there isn't enough insulin doing its job, what happens next in the body? What's the chain reaction?
Right. Well, insulin's job is to help get glucose sugar out of the blood and into the cells for energy. When that doesn't happen properly.
The cells are starved for energy.
Exactly. And the body starts breaking down its own tissues, like muscle and fat, at a faster rate to try and compensate. This really messes up the whole metabolic balance.
And the high blood sugar itself causes problems too.
Definitely. The kidneys try their best to reabsorb the glucose, but when the blood sugar is consistently high, they just get overwhelmed.
So they can't keep up.
Nope. And that excess glucose ends up in the urine. That's called glucosuria.
Glucosuria. Okay.
Now, glucose naturally pulls water with it. So lots of glucose in the urine means lots of water being pulled out, too.
Leading to more urination.
Precisely. That's polyuria, increased urination. And because the dog is losing so much fluid...
They get really thirsty.
You got it. That's polydipsia, excessive thirst. They're trying desperately to replace the water they're losing.
Okay, so increased urination, increased thirst. Those are the big ones people talk about.
They are classics, yes.
But our source also mentioned something that seems kind of contradictory. Increased appetite, but the dog is losing weight. How does that work?
Yeah, that one trips people up sometimes. It's called polyphagia, increased appetite. It happens because insulin normally helps signal to the brain's satiety center that the body has enough energy that it's full.
Ah, so without proper insulin function, the brain doesn't get the stop eating signal.
Exactly. The brain thinks the body is starving, even if the dog is eating a lot. But because the cells can't use the glucose from the food properly...
The body breaks down its own tissues anyway, causing weight loss. Wow.
Precisely. It's like having a full pantry but no can opener. The food's there, but the body can't access the energy effectively.
That's a great analogy. So the body's basically starving despite eating. What else happens downstream from this inability to use glucose?
Well, that breakdown of body tissues isn't good. Protein breakdown leads to more muscle wasting and weight loss.
Right.
And fat breakdown increases. Fats, or lipids, get mobilized and released into the bloodstream in higher amounts.
Which causes What?
It can lead to high levels of fat in the blood, hyperlipidemia, and that excess fat can start to accumulate in the liver.
Oh, like fatty liver disease.
Exactly, hepatic lipidosis, which can become a serious liver problem on its own.
Okay.
And importantly, especially with IDDM, where there's a real lack of insulin to regulate fat breakdown, the body starts producing these alternative fuel sources called ketones.
Ketones.
Yeah.
Right. I've heard about those. Are they bad?
They're a normal byproduct when fat is burned for energy, but when they're produced in large amounts because the body can't use glucose, that's a
How
problem.
is that?
Because ketones are acidic. A massive buildup can overwhelm the body's buffering systems and lead to a dangerous state called metabolic acidosis.
Making the blood too acidic.
Yes. And this whole process can also mess with electrolytes, like causing potassium levels to drop, which is critical for muscle and nerve function.
Man, it really sounds like this insulin issue spirals out and affects a lot of different systems.
It absolutely does. It's not just about blood sugar.
Our source did outline the main body systems that take a hit. Can you quickly summarize those for us?
Sure. So obviously the endocrine and metabolic systems are ground zero, leading to those electrolyte issues and the potential for acidosis.
Okay.
The liver, as we just said, can suffer from that fat accumulation, hepatic lipidosis.
Right.
The eyes are very commonly affected. Cataracts are a really frequent complication in diabetic dogs.
Cataracts, okay. That's a big one.
Yeah. And then the kidneys and urinary tract. The glucose in the urine itself, glucosuria, leads to the increased urination, but it also makes the urinary tract a much friendlier place for bacteria to grow.
Oh, so they're more prone to urinary tract infections.
Much more prone, yes. So you see, it really becomes a whole body condition.
Definitely. It's a ripple effect.
Okay.
So let's shift gears a bit. Why do some dogs get this? Is it just bad luck, or are there specific factors involved, like genetics?
Genetics seems to play a really significant role. The source material strongly suggests this.
How so?
Well, it points out that certain broods just show up with diabetes way more often than others. This suggests they might inherit a tendency for their immune system to mistakenly attack those insulin-producing cells in the pancreas. It's called immune-mediated isletitis.
Immune-mediated isletitis. Okay. Are there particular breeds that owners should maybe be more aware of?
Yes, the text specifically lists Samoyeds, Tibetan Terriers, Cairn Terriers, and interestingly, Golden Retrievers, but specifically in the U.S.
Wait, only in the U.S.?
Get this, the same source mentions that in the U.K., Golden Retrievers are actually less likely to get diabetes.
No way. That's fascinating. A geographical difference like that.
Isn't it? It really suggests the genetics might be complex, maybe interacting with environmental factors differently in different places.
Wow. Okay, any other breeds on the higher risk list?
Potentially Keeshonds, Poodles, Dachshunds, miniature Schnauzers, and Beagles might have a higher tendency too.
And on the flip side, breeds less likely.
Boxers and German Shepherds seem less prone, along with those UK Goldens we mentioned.
So genetics is definitely a big piece of the puzzle. What about other factors? Age, sex.
Yeah, age is a factor. The typical onset is around middle age, say 8 years old on average, but the range is pretty wide, maybe 4 to 14 years.
Okay.
And it does seem to be diagnosed more often in female dogs.
Interesting. And besides the genetics causing that immune attack, are there other triggers or risk factors?
Well, that immune attack on the beta cells is considered the primary cause in most dogs, but other things can increase risk or potentially trigger it.
Like what?
Being an intact female dog in distress, that's the period after being in heat, the hormonal changes during that time can really interfere with insulin action.
Ah, hormones. Makes sense.
That genetic predisposition we talked about is key. And also, certain medications can increase the risk. Things like glucocorticoids, steroids, and progestins.
Okay, so steroids and certain hormone drugs. Good to know. So for pet owners listening, what are the absolute key signs they should watch for that might mean, uh-oh, maybe I should get my dog checked for diabetes?
The big three, the classic signs, are definitely increased urination,
Polyuria.
right? Increased thirst.
Polydipsia.
Yep. And often an increased appetite,
Polyphagia.
even though the dog is losing weight. If
Yeah.
you see that combination, that's a major red flag.
Got it. Peeing more, drinking more, eating more, but losing weight. Are there other, maybe less obvious signs or things that show up later?
Yeah, if it's been going on a while or isn't well controlled, other things might appear. A vet might feel an enlarged liver when examining the dog.
Okay.
Cataracts, those cloudy eyes, are very common, as we mentioned. You might also just notice your dog seems tired, less energetic, maybe a bit depressed lethargy.
Right, just not themselves.
Exactly. And in more severe cases, especially if those ketones build up significantly and cause that acidosis,
Then what?
then you might see a loss of appetite or even vomiting. That's usually a sign things are quite serious.
Okay, so if an owner spots these signs, they head to the vet. How does the vet actually confirm it is diabetes? What's the diagnostic process like?
It's usually a combination of those clinical signs the owner reports and then specific tests. Blood tests are absolutely key.
Looking for high glucose.
Exactly. Persistently high blood glucose, usually above a certain level, like say 200 milligrams per deciliter, is a strong indicator according to our source.
In urine tests.
Crucial. Finding glucose in the urine glucosuria is abnormal and points strongly towards diabetes, especially combined with high blood sugar.
Does the vet usually run other tests too?
Oh yeah, they'll typically run a broader blood panel, like a chemistry profile and complete blood count, to check overall organ function, look for signs of infection or inflammation, check electrolytes, cholesterol, things like that. Elevated liver enzymes or cholesterol can also fit the picture.
Give them the bigger picture of the dog's health.
Precisely. Helps rule out other things and spot any complications or concurrent conditions.
What about measuring insulin levels directly? Does that help diagnose it?
You know, it's interesting. The source suggests measuring insulin isn't always that straightforward for the initial diagnosis.
Oh, why not?
Well, while very low levels would certainly suggest IDDM, sometimes the persistent high blood sugar itself can temporarily suppress insulin secretion, even if the pancreas could still make some. So it's not always a clear yes or no early on.
So the high blood sugar and sugar in the urine are more reliable indicators.
Generally, yes, for confirming the diagnosis. Imaging, like X-rays or ultrasound, might also be used.
Not to diagnose the diabetes itself,
But to look for other potential issues, maybe pancreatitis or signs of Cushing's disease or urinary stones, things that could be contributing to the signs or might complicate treatment.
gotcha. So diagnosis involves signs plus blood and urine tests, maybe imaging for context.
Mm-hmm.
Okay, let's say the diagnosis is confirmed. What comes next? Treatment and management sounds like a big commitment.
It is, and it really becomes a team effort between the owner and the veterinary team.
Does the dog need to stay at the hospital?
Sometimes. If a dog is really sick when diagnosed, especially if they have that diabetic ketoacidosis, the DKA, they'll definitely need hospitalization first to get stabilized with IV fluids and insulin therapy.
But if they're stable?
If they're stable, management can often start at home, and diet becomes absolutely critical.
Okay. What's the goal with diet?
Consistency is key. Same food, same amount, same times every day, basically. The goal is to have predictable glucose absorption from the gut.
And how does that relate to the insulin shots? You mentioned timing earlier.
Right. This is super important. Since most insulin types used in dogs have their peak effect a few hours after injection, you generally want to time the meal so the glucose absorption lines up with when the insulin is working hardest.
So feeding after the shot.
Usually, yes. The recommendation is often to feed about 60 to 90 minutes after the twice-daily insulin injection. This helps match the post-meal glucose rise with the insulin's peak action.
What if a dog isn't a big meal eater, like they prefer to graze?
That takes a bit more planning. For grazers, the source suggests maybe leaving some dry food out, but then giving 2 smaller, measured amounts of wet food around the time of the insulin injections.
So you still get that timed food intake with the insulin.
Exactly. If, less commonly, a dog only needs insulin once a day, then the day's food should be split into maybe 2 or 3 meals given within the first 6 to 8 hours after that single shot.
The main thing is consistency and matching it to the insulin.
And feeding the right amount to maintain an ideal body weight. If a diabetic dog is overweight, weight loss is really important.
What about those special diabetic diets, high fiber ones? Do they make a big difference?
That's a good question. While high-fiber, lower-calorie diets can definitely help with weight loss in overweight dogs and might help them feel full, but the source we reviewed specifically states they don't inherently improve the control of the diabetes itself beyond the benefits of weight management if needed.
So consistency and calories are more important than specific fiber content for control.
Seems to be the case based on this text. And snacks are generally a no-no unless they're virtually calorie-free, because they disrupt that predictability.
It really sounds like the owner needs a lot of information and support.
Absolutely essential. Client education is huge. Owners need to understand the feeding schedule, how to give the insulin injections correctly, how to store the insulin.
How to spot problems, right, like low blood sugar.
Critically important. They need to know the signs of hypoglycemia weakness, stumbling, seizures, and what to do immediately if they see them, like giving corn syrup and then calling the vet.
And keeping good records helps.
Immensely. Tracking water intake, weight, insulin dose, appetite, it helps the vet team see trends and make adjustments.
You also mentioned spaying female dogs.
Yes, strongly recommend it. Once the diabetes is stable, spaying removes those hormonal fluctuations from the heat cycle that can make blood sugar control really difficult, even impossible sometimes.
Okay. And the cornerstone of treatment is insulin itself. Are there different kinds vets use for dogs?
Yes. Insulin injections are the mainstay for IDDM and often needed for NIDDM too. Several types are common. There's Vetsulin, which is porcine insulin, meaning it comes from pigs.
Yeah.
There are human recombinant insulins like Humulin N or Novolin N, and another one called PZI Vet. These are mostly intermediate acting.
Meaning they last for roughly half a day.
Generally, yeah, which is why most dogs need injections twice a day. There are also some longer acting ones like Glargine or Detamir, used less commonly perhaps.
Now, you mentioned something really important about syringes.
Yes, this is vital. Some insulins, like Vetsulin and PZI Vet, are U40 concentration. They must be given with U40 syringes.
And others?
Of others, like Humulin N or Novolin N, are usually U100. They need U100 syringes. Using the wrong syringe will lead to a major overdose or underdose.
Wow. Okay. That's a critical detail for owners.
Absolutely critical. Always match the syringe type to the insulin concentration.
What about oral medications?
Yeah.
Like pills people take for type 2 diabetes. Do they work for dogs?
Generally, no. Our source is pretty clear that oral hyperglycemic drugs aren't typically effective or the preferred treatment for dogs.
Why not?
Most dogs have IDDM, meaning their pancreas just can't make enough insulin. Pills that stimulate the pancreas or improve insulin sensitivity don't work well when there's little or no insulin to begin with.
So injections are really the standard of care.
Overwhelmingly, yes. In very rare NIDDM cases, oral meds might be tried, but it needs super close monitoring as it often progresses to needing insulin anyway.
Okay, so regular insulin, consistent diet, and ongoing monitoring seems essential. How often do diabetic dogs need vet checkups?
If a dog is stable and doing well, maybe every 3 to 4 months for a check-in.
And if things aren't stable?
Then much more frequently, obviously.
Mhm.
The vet needs to assess how things are going.
How do they do that? Just by asking the owner how the dog seems.
That's part of it. The owner's observations about thirst, urination, appetite, weight, energy level, that's really valuable information.
But they do tests, too.
Oh, yes. Blood tests are important. They often measure something called fructosamine.
Fructosamine, what's that?
It's a type of glycated protein. Basically, it gives an indication of the average blood glucose level over the previous, say, 2 to 3 weeks. It provides a longer-term view than a single blood glucose check.
Ah, like an A1C test in humans, kind of.
Sort of analogous, yes. Gives a sense of overall control. Sometimes vets also do blood glucose curves.
What does that involve?
That means checking the blood glucose level every couple of hours over a 12 or even 24-hour period. It helps see how low the glucose drops after insulin and how long the insulin's lasting.
Can owners do that at home?
Some owners learn to do it at home with a portable glucose meter, which can be really helpful as it avoids the stress of a vet visit potentially affecting the results. Others have it done at the clinic.
What about testing urine glucose at home? Is that helpful for monitoring?
You know, the source suggests it's actually not very useful for routine monitoring by owners.
Really? Why is that?
Because the urine test only tells you if the glucose is above the kidney's threshold for spilling sugar into the urine. It doesn't tell you how high it is or, more importantly, if it's getting too low.
Ah, so it doesn't warn you about hypoglycemia.
Exactly. And blood sugar can be quite high before it even shows up in the urine. So it's not sensitive enough for making insulin dose adjustments. Blood glucose monitoring, either via curves or fructosamine, is much better.
Okay, that makes sense. Let's touch briefly on prevention. Can we prevent diabetes in dogs?
Well, we can definitely reduce some risks. Spaying female dogs is a big one, eliminating those risky hormonal influences.
Right.
And being cautious with those medications we mentioned, avoiding unnecessary use of steroids or progestins.
What about obesity? Does being overweight cause diabetes in dogs like it can in people?
Interestingly, the source we used stated there wasn't strong evidence linking obesity itself to increased diabetes risk in neutered dogs.
Huh. So keeping them lean is good for overall health, but maybe not a direct diabetes prevention strategy in neutered pets.
Based on this text, yes. Though managing weight is still crucial if a dog becomes diabetic, especially if they are overweight.
Okay. Even with good management, are there still potential problems or complications owners should be aware of?
Unfortunately, yes. Cataracts can still develop even in well-controlled diabetic dogs. It's a very common complication.
Right.
And the big risk with treatment itself is insulin overdose, leading to hypoglycemia, low blood sugar.
We mentioned the signs weakness, seizures.
Exactly. Owners need to be constantly vigilant for those signs and know how to react quickly. That's probably the most immediate danger in day-to-day management.
Okay, so wrapping things up, what's the general outlook? If a dog is diagnosed, what's the prognosis?
For most dogs, diabetes is a permanent condition they'll have for life.
No cure, usually.
Not usually, no. Although the source did mention that very specific scenario where spaying a female during diastrus might lead to temporary remission, but that's not typical.
But with treatment.
With consistent, appropriate treatment, usually meaning that twice-daily insulin and the timed, consistent feeding plan, the prognosis is generally quite good.
So they can live a good life.
Absolutely. Many diabetic dogs live happy, active, high-quality lives for many years with dedicated management. It takes commitment, but it's very achievable.
That's really good to hear. So to just quickly recap the big points, canine diabetes is mostly about the body not making enough insulin, IDDM. This causes high blood sugar, sugar in the urine, and those classic signs of drinking, peeing, and eating more, often with weight loss.
Right. Diagnosis relies on those signs, plus blood and urine tests.
And management is a lifelong partnership involving consistent diet, carefully timed insulin injections using the right type and syringe, and regular monitoring with the vet.
You've got it. Early detection and that close collaboration with the vet team are really the keys.
Thinking back on everything we've discussed, what detail kind of stands out to you as particularly interesting or maybe unexpected about canine diabetes?
For me, I think it's that breed predisposition aspect, especially the geographical difference, like with the golden retrievers. It just highlights how much we still have to learn about the interplay between genetics and environment.
Yeah, that was fascinating. For me, it's probably just the sheer number of body systems affected by this one hormone, insulin being out of whack. The liver, the eyes, the kidneys. It really shows how interconnected everything is.
It really does. And hopefully for you listening, this deep dive gives you a much clearer picture. If your dog ever shows these signs or has been diagnosed, you're now better equipped to understand what's going on and work with your vet.
Absolutely. Understanding these complex processes really empowers us to provide the best possible care for our companions. It's quite amazing how these intricate systems work, isn't it?
It truly is.